It's time for another Ask the Doctor's question. This one comes from Frankie, who is joining us via Skype with a question. Frankie, so good to have you. Take it away. What's your question?
I've been struggling for the past 4 years with dry lips. My lips are become inflamed. They swell, they dry, and I've lost almost all my pigment on my lips. This has been affecting the quality of my life. I am desperate for help, and I would like to know if there's anything you can suggest to help me with this problem.
Does it affect anywhere else on your skin or just specifically your lips?
My arms, my chest, when I'm exposed to a lot of sun, the back of my neck, so anything that is exposed to the sun.
And when that happens, is it itchy or is it painful? Do you have any symptoms?
It's itchy, very itchy and uncomfortable, but not a lot of pain, just very itchy.
Well, so Frankie, I think the pigmentary change that you're experiencing, which is what triggered you to write into the show, is really something that's more post-inflammatory, meaning that when you have pigmented or olive-toned skin, there's often an upregulation or a downregulation, an increase or decrease in the pigment afterwards, and it's kind of an unwanted souvenir from that prior inflammation. But I think the primary issue, especially given those really impressive photos of the rash you have and the sort of aspect of it being triggered by light, is really the source of this and what's going on. And I know that you have had a couple biopsies and you've been given a couple of different answers. And the show shared those with me. It sounds like your puppy's in the background. The show shared those with me.
Hey, buddy. Real quick, we just want to say hi. What's the dog's name?
Dusty.
Hey, Dusty.
Hi, Dusty. Dusty wants to be on the doctors too. So when I looked at your pathology reports, I think the reason it's been a little bit confusing is because this does affect different areas of your skin and your body. And putting them all together, there's a newer diagnosis called lichenoid photodermatitis. And so this might not have been at the fingertips of the people looking at the separate biopsies, but what that is that's a contact allergy often triggered by certain chemicals or makeups or products that then in combination with light, as you pointed out, the sunlight, causes this very, very particular pattern of inflammation that disrupts the pigmentary layer in your skin. So I actually think, I know you've had some very basic allergy testing, and that showed us that showed a sensitivity to nickel, which can certainly be in certain cosmetics. But I really think the next step for you is going to be to do some allergy testing to see what in conjunction with light might be triggering this recurrent inflammation. And then that actually can at least be prevented before you even know what the trigger is by better light protective measures. So sun protective clothing, using a really good mineral-based broad spectrum sunscreen day to day just to shield you from the light while you're still figuring out what the cause or the triggers are. And I think that's going to serve you much better than just throwing antihistamines and cortisones at the inflammation once it's already occurred.
Okay, sounds good.
But we also have something for you. We reached out to Dr. Joel Spiro near your hometown. He is going to do a consultation with you and put you on a treatment plan. We also reached out to Dr. Chris Smith at Smith Allergy and Asthma Specialist. They're going to meet with you for a consultation and another round of allergy testing just to make sure all of the bases are covered in terms of potential allergens. And last but not least, we reached out to Color Cosmetic Studio. Provided you're a good candidate, Kathleen Cronin is going to provide you with a paramedical cosmetic micropigmentation tattoo to help restore your lip color.
Thank you.
Good luck with all these treatments, and give Dusty a little pat on the head for us as well.
Frankie, we really wish you all the best.
Thank you.
Hope we can help with this.